The Health Department has confirmed 3 more cases of the Mpox virus in Gauteng. A 38-year-old man and 2 of his contacts in Ekurhuleni recently tested positive for the virus. This brings to 31 the total number of cases since the outbreak last year. The department is urging members of the public to remain cautious. Health Department spokesperson Foster Mohale joining us now to discuss this. Mr. Mohale, good evening to you and thank you for your time. I'd like to start with the relationship between these 3 people that have now been, that have tested positive for the Mpox virus. Is there a relationship between them?
Good evening to you, Toli, and good evening to your viewers at home, and thanks for this opportunity once more. Yes, we can confirm that the latest 3 cases detected in Ekurhuleni, Gauteng province, they are related. The first one, we're still trying to establish if it's related to the first. Remember, towards the end of February, we recorded 3 cases with 1 patient with travel history to Uganda, where currently they're battling the outbreak of cholera. That patient had 2 contacts. So even this time, we confirmed the first case. When we continued with our contact tracing, we managed to confirm 2 other cases. So we can confirm that the current 3 cases are closely related.
So these are family members. I think that's what I meant to say earlier.
Family, we'll just say they are associated in terms of the close relationship. We don't know how close, whether they are friends, but what we can confirm that they are very close to each other. Hence, we managed to track down the 2 because of cooperation and assistance with the first case, which is a 38-year-old man.
In your statement, you say between the 3 of them, there is no history of travel outside the country. This means then that this virus is spreading locally. Let's understand how the Mpox virus is transmitted from one person to the next.
Yes, we can confirm exactly what we are saying, that the fact that none of the 3 cases had recent travel history to countries or regions currently experiencing the outbreak of Mpox, that strongly suggests that there's ongoing transmission, local transmission around the country. So in terms of how the disease spreads, it spreads mainly through close physical contact. When one person who tested positive is having close contact in the form of either kissing, either exchanging items, either having unprotected sex, or coughing or sneezing without closing or covering the mouth and the nose. As you remember, during the time of COVID, we kept on encouraging people to say, when you cough, when you sneeze, try to cover your nose, your mouth, so that you don't spread the droplets that come from your nose or your mouth. So these are some of the methods of transmitting this infectious virus from one person to another.
You also add, Mr. Mohale, that these 3 patients have also tested positive for what is called Herpes simplex virus. What is that, and is it strange? Is it the first time that this is being picked up on Mpox virus patients?
Definitely, we can confirm exactly what we said, that these patients, they tested also positive for this disease that we've just mentioned. But this is a relatively unknown type of disease, but is common in the country. It's manageable, but it is not treatable. So it as the transmission methods of this virus is similar to Mpox and other sexual transmitted disease. That's why we also emphasize and encourage people who experience the symptoms of this, which include painful ulcers or blisters, to seek medical care as soon as they experience this. And we'll remember that some of these symptoms, the symptoms of Mpox, the symptoms of this virus, the symptoms of flu, the symptoms of COVID-19 are similar. So hence we say people, you'll never know until you conduct a test whether you contracted either Mpox, COVID-19, or any of these diseases. So hence we encourage people who experience any of these symptoms not to self-diagnose, not to self-treat. As you know that some people will go to a pharmacy or chemist to go and seek over-the-counter medication where you don't need script to say, please, can you give me this or that? So we want to discourage people from doing that, especially in the wake of these infectious diseases that we're dealing with, to say, please, just present yourself to the nearest healthcare so that they can run the test and tell you what kind of disease you are suffering from. Then they can put you on the right treatment, because once you self-diagnose and self-treat, you will end up treating the wrong disease.
Yeah. I just want to repeat the symptoms related to this additional virus that they have now also been diagnosed with, which is the herpes simplex virus. You're saying that it causes painful blisters or ulcers, which spreads through skin-to-skin contact, including kissing and or unprotected sex. Let's talk then about the symptoms of the Mpox virus itself. What is it that people should go to the doctor for if indeed they start experiencing these particular symptoms? How does the Mpox virus present?
Yes, also as I respond to your question, I want to emphasize that the Mpox symptoms are not unique symptoms. They are similar to symptoms of other diseases like your flu and COVID-19. So in terms of Mpox, the symptoms that include very painful rash throughout the body, on the mouth, and also on the legs. Someone may feel a headache, your fever. Someone will feel fatigue and loss of appetite. So these are some of the common diseases, but the main common disease will be a rash, a small rash, very painful, which develops throughout the body. So people should not try to self-treat such rash if they develop. So hence we want to emphasize that this disease can affect anyone regardless of age, gender, sexual orientation, or race. And we urge people to support those who are confirmed or diagnosed with disease in order to avoid stigma, because what we've established is that the reason why people don't come forward to clinics to seek medical care is precisely because of stigma. So let's support people in order, instead of stigmatizing, because the more you stigmatize people is the more we are putting ourselves and the rest of the community at risk, because if one tested positive is not seeking medical care, that can spread the disease across the community level, the household, but also throughout the country. So, but also what we want to emphasize is that as much as the country has recorded about 31 cases since the outbreak last year, only 3 active cases we are dealing with. The rest of the cases have recovered.
Yeah, and that's a very important point to make as we end this conversation. Should the public panic, given that this appears to be circulating locally now? As we said earlier, there is no history of travel outside with these latest patients. Should the public panic?
Look, there's no need for public to panic, because as government, we are strongly convinced that this situation is under control, but the public should be equally concerned. Just like government, we are concerned about these cases without international travel history to areas or countries currently experiencing the outbreak of this infectious disease. So there's no need for public to panic, but there's a need for public to be concerned, because you'll never know. Maybe it's also transmitting in your own locality, among your own group, circle of friends, within your workplace. So there are many ways we can be able to curb the spread of this infectious disease. No need to panic, but there's a need to be concerned.
Foster Mohale speaks for the National Department of Health. Thank you very much for your time and that information. Very important indeed.